Thank you, Alana, and thank you everyone for joining us at our Earth webinar series. And we're super excited today because we're going to have Rachel Sklar, who is a postdoctoral fellow working with Amy Padula in the program on reproductive health and the environment. And she is going to talk about her research, which is focused on understanding environmental drivers of environmental exposures in vulnerable populations, including work on wildfire smoke exposures in pregnant people and incarcerated populations in California. I'll turn it over to you. Thanks, Rachel.
Thanks, Tracy. Okay, here we go. Let's see. Is that good? Are you all seeing the right screen?
Yep, looks perfect.
Excellent. Great. Well, I am excited to share some of what I've been working on these past few months, years actually, with PRE. Today I'm going to be talking about wildfire smoke exposure and preterm birth, particularly aspects of race, ethnicity, and housing factors. So I'll start by saying, I mean, most people here probably already know that wildfires are a major source of air pollution in the United States, and that exposure to wildfire smoke can trigger adverse birth outcomes for pregnant people, preterm birth being one among many. And wildfire smoke is a mix of particulate matter, gases like ozone, carbon monoxide, nitrogen dioxide, PAHs, heavy metals, elemental and organic carbon and VOCs. And because of increased respiration during pregnancy, pregnant people are especially vulnerable and susceptible to smoke exposure and all types of air pollution for that matter. So wildfire smoke exposure in pregnancy can impact different biological mechanisms that are shown here in this awesome figure. So wildfire smoke exposure can contribute to inflammation, oxidative stress, vascular dysfunction, and other DNA damage that ultimately leads to adverse outcomes such as preterm birth. And sure enough, preterm birth is increasing in California, where we also have an increase in wildfires. According to a recent study, 5% of all preterm births are attributable to PM 2.5, and then about half of the total PM 2.5 in California is from wildfire smoke, especially in these high smoke years. There also seems to be a geographic coincidence of places where air pollution exposure generally and wildfire smoke exposure may be particularly high, and where there are excess preterm births in the state. So the San Joaquin Valley is an example of an area that has a high incidence of preterm birth and also relatively high levels of smoke exposure. And because of the expected increase in smoke exposure and the association between this exposure and preterm birth, it's important for us to understand who is the most vulnerable to this exposure and what specifically makes them most vulnerable. So I'm going to talk about two areas of vulnerability today that may cause disproportionate smoke exposure, and those are the characteristics of the home that one lives in as a pregnant person and the race ethnicity of a pregnant person. And I'll start with the discussion of housing characteristics. This is a picture of my backyard in the East Bay on Orange Day, as we call it, September 9th, 2020. Remember that? So one factor that is overlooked in studies of wildfire smoke exposure or any exposure to air pollution in general is the infiltration of outdoor pollutants into the indoor environment. So I did not go outside on Orange Day, but I definitely felt the smoke inside. My house in Oakland is over 100 years old, definitely not airtight. And so, yeah, many studies assume that exposure to smoke happens outdoors and rely on ambient concentrations for exposure assessment. But potential exposure to wildfire smoke indoors has been studied much less. So I'm interested in understanding if certain housing characteristics may allow for more infiltration into the home and therefore increase indoor smoke exposure and smoke-related preterm birth. And to understand how housing characteristics can potentially contribute to this smoke indoors and the outcome of preterm birth, I've merged 3 data sets. So those are the birth records, California birth records. I'm sure many of you are familiar with that. The HMS smoke data and data from the California tax assessor. And we've matched this data at an individual household level. So the birth records contain the birth outcome, which is preterm birth. The smoke days exposure is from this database, HMS smoke data. It's a NOAA database that uses satellite imagery to map the extent of smoke-related plumes, which we can then estimate the number of smoke days that an individual is exposed to. And then the tax assessor data has characteristics on individual homes, like the size of the home, the year built, the building style, the value of the home, any major renovations. So this tax assessor data is what populates real estate websites like Zillow and Redfin and all those that I'm sure you guys are aware of. So to match the data from the tax assessor to the birth records, I worked with Dan Meltzer from the EaRTH Center. He helped me geocode the tax assessor history and then match those records to the geocoded birth records. So before that, I had tried to match the data sets via address, but only got a 60% match rate. With the help of Dan and the EaRTH Center, we got it up to a match rate of 69% for some of the years. So that's pretty good. And this was no small feat. And I just want to shout out Dan and the EaRTH Center for all of the help doing this work with me. And I think this is a huge contribution, not just to this project, but to the field to have this, amazing matched data set on a household basis. And so, yeah, this work was funded by a Seedling grant. So, yeah, shout out to the Seedling grant, and I encourage everyone to take advantage of this amazing resource. Anyways, with the matched data set, we can now look at how the physical characteristics of the home affect the association between wildfire smoke exposure and preterm birth. So one of the factors that we are looking at is air tightness of a building. So air tightness is a building property that affects infiltration and therefore any pollution that can get into a home. So factors that affect air tightness include the age of construction, the size, and the type of foundation, among other factors that I'm not yet looking at. So older homes are known to be leakier, as are smaller homes, and those that have a crawl space foundation instead of a solid slab. So the data from the tax assessor also had information on the type of cooling system used in homes. And I'm interested in looking at homes with swamp coolers, and I'll tell you why. So swamp coolers work by passing dry outdoor air over water saturated pads, the evaporative media. And when the water in the pads evaporates and water molecules are added to the air, that is what cools the space. So these types of coolers are the most effective in lower humidity environments like Southern California, Inland Empire, San Bernardino County, places like that. The drier the air is, the more powerful a swamp cooler can be, and you can't use them when it's too humid. So when you're using a swamp cooler as the way to cool your home, you're bringing in 100% outdoor air. It's not like a more traditional AC where you can recirculate some of the air that is already cooled. In order for a swamp cooler to be used, you need to be constantly bringing that dry, hot outdoor air in and passing it over the media. So these types of coolers, you know, in the event of a wildfire, because they are used in the hottest and driest places, people might not have a choice to not cool their home during, you know, wildfire events in the summer and early fall. Okay, so we know that homes that are older and smaller and built with a crawl space foundation allow more infiltration of outdoor pollutants into the home. And we also know that swamp coolers work by bringing in air from the outside indoors. So my hypothesis is that small homes, old homes, and those with crawl spaces and swamp coolers, in these more leaky homes, we would expect more infiltration of wildfire smoke during a smoke event, and therefore expect to see an increase in smoke-related preterm births for people who live in those homes. So I looked at the association between smoke days and preterm births stratified by home age. And based on the previous studies of leakage, we would expect that the association would be higher in the lowest quartile or the oldest homes, which is not the case here. Instead, we see basically no systematic association between the age of the home and the strength of the exposure outcome association. And so as a next step, I looked at whether the association may be higher in urban versus areas closer to the wildland urban interface to see if leakiness maybe matters more or less in those two different scenarios. And for those of you who don't know what the wildland urban interface is, we call it WUI, and what it stands for is the Wildland Urban Interface, WUI. And this is a zone of transition between wilderness land and people inhabited land. So basically where the built environment meets the natural environment. And if you look at the map at the center of the slide, a lot of the counties in and around the Bay Area have a high percentage of WUI areas. So, you know, just as an example, I'm looking at a very urban county, San Francisco, and Sonoma, a county that has a very high percentage of homes at the WUI. And overall, the association between smoke and preterm birth in the newer homes, the newer homes are more protective, as one would expect in the WUI. But in the urban example, the newer homes don't have the same protective effect as we would expect based on leakiness. Actually, in the urban areas, the older homes also seem to be slightly, in the urban areas, the older homes seem to be slightly protective, which could say something about older homes being valuable, well kept up, more renovated. You know, if you think of an urban area like San Francisco, like a Victorian home may be older, but the residents would tend to be higher income, go for more renovations and keep them more well-maintained. So that's perhaps why what we're seeing in San Francisco maybe breaks the trend of what we'd expect in terms of older homes being more leaky. Okay, so looking at a different factor of leakiness, home size, when looking at the association stratified by size. The largest houses seem to have the highest association between smoke and preterm birth, and this is the opposite again of what we would expect. Larger houses have been shown to be tighter per unit of exterior wall than smaller ones, and that may be because they're built with more quality materials and superior workmanship, or they tend to be better maintained. So again, digging deeper, I look at what's going on in an urban county versus a county at the WUI. And what I see is that the larger homes are more protective, again, in the WUI area, which is what we would expect. But in the urban area, the larger homes show the higher association between smoke and preterm birth. The smallest homes seem to be protective in both urban and WUI areas. And just thinking about size, one aspect of this analysis that needs to be adjusted for in the next round is separating single family versus multifamily homes, as this is a big factor in leakage as well. For example, one would expect that a small single family home would be less leaky than a small multifamily home. So separating out those home types can help isolate the size effect, but I didn't have time to do that before this presentation. So this is also just one example of an urban and a WUI county. So as a next step, I will investigate if these trends hold true for other urban and counties at the wildland urban interface. So when looking at the association between smoke and preterm birth stratified by the type of foundation, the raised foundation, the concrete foundation, and other types of foundation homes have a stronger association than the slab foundation. This is in fact what we would expect according to our leakiness hypothesis. Foundations with crawl spaces have been shown to be leakier in the literature, and those in the raised, the concrete, and the other categories can definitely be crawl space foundations. The slab foundations that are known to have the lowest leakage and known to be the most airtight, in fact, come out as protective here. So as far as HVAC type, homes with swamp coolers are those that have the highest association between smoke exposure and preterm birth. So again, our hypothesis, this confers. Swamp coolers are more likely to bring smoke indoors. And as I mentioned, since swamp coolers are used in areas of the state that are very dry and get very hot, people really don't have a choice whether to use them or not, especially in the summer months. So in homes that are not cooled, there may be behavioral differences that are contributing to this high degree of spread that you see here. Some people might open their windows during a smoke event, others may choose not to do that. And on the right, you can see that the swamp coolers are used primarily in these hot and dry places like San Bernardino County, Kern, Fresno, and then just a few other northern counties. So I'm now going to talk about another aspect of my work that is looking at disaggregated race ethnicity to better understand disparities, especially in the Asian American population in California. There's been a lot of work looking at racial and ethnic air pollution disparities in the state, but not so much work that has looked at disaggregated race groups. If we're looking at preterm birth rates alone, the highest rates of preterm birth happen in the Black subgroup. And then after that, there are several Asian subgroups that have very high rates of preterm birth in the state. Filipino, Guamanian, Pacific Islander, Hawaiian, to name a few. So this calls for an understanding of what is driving these disparities. Before I get into that, I want to discuss why more generally we should disaggregate data on Asian Americans, especially in health studies. So Asia is over 40 countries. It's not including the Pacific Islands. And due to differences in social, economic, and environmental factors, it's just not right to assume that the health disparities that apply to one subgroup apply to the whole group, the whole API population. So when we look at health disparities between different Asian subgroups, we see that subgroups like Chinese and Filipino are worse off than Asian Indians or other Asian groups in terms of health status, medical bills, and asthma here on the left panel. And then when we include Hawaiian and Pacific Islanders, we see that health status is poorest in those groups compared to other Asian subgroups and whites by various different metrics: medical bills, health status, asthma, diabetes, and reproductive health. So I looked at the association between smoke days and preterm birth, stratified by aggregated race, ethnicity, subgroup analysis on race, ethnicity, and health outcomes is most commonly done in these aggregated race groups. So when we look at them, we see that the strongest association is in the API group. And this should be reason to dig deeper into the API group and see who and what is driving this disparity. So one of the challenges of doing this disaggregated work is that the sample sizes in some of the subgroups is so small. For example, the Guamanian and the Samoan groups that have high associations with preterm birth and smoke exposure have smaller sample sizes and therefore broader confidence intervals. So I combine these groups back into a single Asian Pacific Islander subgroup, which is the group that you see on the far right, and left the other groups disaggregated, and saw that when I combined the Guamanian and Samoan subgroups into the aggregated Pacific Islander subgroup, the association goes down quite a bit. So the effect of those groups gets lost. And this is just pointing out a challenge of doing this disaggregated work. So I'll just talk briefly about a few policy directions. In California, we have a low-income weatherization program aimed at equipping low-income households with weathering their homes. So this is for energy upgrades to make their homes more efficient and airtight, ultimately lowering their energy bills. And this is a policy that, you know, could potentially be leveraged for protection from wildfire smoke as well in the most vulnerable home types. So right now, in order to receive energy efficiency or weatherization services from a local provider, you have to meet certain eligibility requirements like income, household size, energy use, and other factors. So understanding where the overlaps are in terms of those eligibility requirements and the vulnerability factors for smoke exposure within a home is important, and you know, a direction I want to go with this project. Also, including the smoke vulnerability factors from a housing characteristics perspective, and the public health vulnerability factors in this way could be part of the eligibility for the weatherization program in the future. Another policy direction is mandating certain types of air conditioning or home upgrades. So in LA, very recently, they voted to mandate air conditioning and rental units. So this is not an unreasonable direction where this type of work can inform this kind of policy for areas that are most vulnerable to smoke infiltration. This mandate in LA sort of came from a public health perspective, just emergency room visits because of people getting too hot in their homes. And then, of course, addressing the housing deficit in climate resilient areas. Coastal Californian cities have become so expensive to live in, so populations are moving more inland to the WUI. So addressing this deficit is perhaps the most fundamental way to protect people from the types of exposures that I spoke about. We have a whole paper on that, so I won't get into it, but check out Sklar do a commentary in the International Journal of OBGYN for more on that. And yeah, earlier I showed a picture of my backyard in 2020. And on the right is a picture from my friend's Brooklyn apartment in 2023. So we are not the only ones who are having orange days anymore. New York, Canada have their orange days too. So the work that I'm doing to understand how housing factors and race ethnicity contribute to smoke exposure disparities and preterm birth disparities is relevant across the country and across the world. And this work is just getting started, and future directions will continue to explore the individual housing factors and also the combination of factors and characteristics that make individual residents vulnerable to smoke infiltration. So I would love to talk to anyone more about methods to do this type of work. Please feel free to reach out. And I just wanted to say thanks to everyone that has made this work possible, especially my mentor, Dr. Amy Padula, my collaborator at the EaRTH Center, Dan Meltzer, and all of my other colleagues at PRE and the EaRTH Center.
So thank you, everyone. And I just want to re-emphasize, it's so great that, Rachel, that your presentation was excellent, and it was great to hear how the EaRTH Center helped you with adding this extra data element, the tax assessor records. Very interesting. And so if people have other ideas like that, please hit us up. And we will be having our next earthinar is in August 10th by Laura Cushing, who is a faculty member at UCLA, and then Raquel Chamorro Garcia from Santa Cruz will be giving a talk. Oh, also in August. We have 2 in August. Very exciting. So stay tuned for the information coming out about that. And thank you everyone for attending. And you can always go to our website and ask us any questions. And I know Alana's on here. She's always super helpful with anything any idea you have that we might be able to help you with.
Thanks, everyone. Have a great day.
Thank you. Bye-bye.
Thank you, Rachel.